everybody! Today we are back here with you with a kind of scientific but a strange video. There are many illnesses in the world that we are aware of, but also there are very rare and strange syndromes that you might not imagine that anyone could suffer from. So please watch this video until the end and subscribe to the About It All YouTube channel to support us. Let's get started. Pica is a compulsive eating disorder in which people eat non-food items. Dirt, clay, and flaking paint are the most common items eaten. Less common items include glue, hair, cigarette ashes, and feces. The disorder is more common in children, affecting 10% to 30% of young children ages 1 to 6. It can also occur in children and adults with intellectual and developmental disabilities. On rare occasions, pregnant women crave strange non-food items. For these women, pica often involves eating dirt and may be related to an iron and zinc deficiency. Symptoms of pica. Pica symptoms are related to the non-food item the person has eaten. They include stomach upset, stomach pain, blood in the stool, which may be a sign of an ulcer that developed from eating non-food items, bowel problems, such as constipation or diarrhea. These symptoms are the result of the toxic, poisonous, and bacterial content of the non-food items. Repeatedly eating non-food items over a period of time can cause lead poisoning from eating paint chips that contain lead, an intestinal blockage or tear from eating hard objects such as rocks, injuries to teeth, infections from organisms and parasites that get inside the body and cause disease. Prosopagnosia, also known as face blindness, means you cannot recognize people's faces. Face blindness often affects people from birth and is usually a problem a person has for most or all of their life. It can have a severe impact on everyday life. Many people with prosopagnosia are not able to recognize family members, partners, or friends. They may cope by using alternative strategies to recognize people, such as remembering the way they walk or their hairstyle, voice, or clothing. But these types of strategies do not always work. For example, when a person with prosopagnosia meets someone in an unfamiliar location, the impact of prosopagnosia. A person with prosopagnosia may avoid social interaction and develop social anxiety disorder, an overwhelming fear of social situations. They may also have difficulty forming relationships or experience problems with their career. Feelings of depression are common. Some people with prosopagnosia cannot recognize certain facial expressions, judge a person's age or gender, or follow a person's gaze. Others may not even recognize their own face in the mirror or in photos. Prosopagnosia can affect a person's ability to know objects such as places or cars. Many people also have difficulty navigating. This can involve an inability to process angles or distance, or problems remembering places and landmarks. What causes prosopagnosia? There are two types of prosopagnosia. Developmental prosopagnosia, where a person has prosopagnosia without having brain damage. Acquired prosopagnosia, where a person develops prosopagnosia after brain damage, often following a stroke or head injury. In the past, most cases of prosopagnosia were thought to occur after a brain injury, acquired prosopagnosia. But research has found that many more people have prosopagnosia without having brain damage, developmental prosopagnosia, than was first thought. Lycanthropy, from Greek lykos, wolf, anthropos, man, mental disorder in which the patient believes that he is a wolf or some other non-human being, undoubtedly stimulated by the one widespread superstition that lycanthropy is a supernatural condition in which men actually assume the physical form of werewolves or other animals. The delusion has been most likely to occur among people who believe in reincarnation and the transmigration of souls. Usually, a person is deemed to take the form of the most dangerous beast of prey of the region, the wolf or bear in Europe and northern Asia, the hyena or leopard in Africa, and the tiger in India, China, Japan, and elsewhere in Asia. But other animals are mentioned too. Both the superstition and the psychiatric disorder are linked with belief in animal guardian spirits, vampires, totemism, witches, and werewolves. The folklore, fairy tales, and legends of many nations and peoples show evidence of lycanthropic belief. Standal Syndrome. Standal Syndrome or Florence Syndrome is a psychosomatic condition involving rapid heartbeat, fainting, confusion, and even hallucinations. Allegedly occurring when individuals become exposed to objects, artworks, or phenomena of great beauty and antiquity. Standal Syndrome was named after Marie Henry Bale, 1783-1842, better known by his pen name Standal. The affliction is named after the 9th century French author Standal, pseudonym of Marie Henry Bale, who described his experience with the phenomenon during his 1817 visit to Florence in his book Naples and Florence, A Journey from Milan to Reggio, when he visited Basilica di Santa Croce, where Niccolò Machiavelli, Michelangelo, and Galileo Galilei are buried. He was overcome with profound emotion. Standal wrote, "I was in a sort of ecstasy from the idea of being in Florence, close to the great men whose tombs I had seen. I had palpitations of the heart, what in Berlin they call nerves. Life was drained from me. I walked with the fear of falling." Alice in Wonderland Syndrome. AIWS is a rare neurological disorder characterized by distortions of visual perception, the body image, and the experience of time. People may see things smaller than they are, feel their body alter in size, or experience any of the syndrome's numerous other symptoms. Since there are also many known causes of AIWS, diagnosis requires a thorough neurological workup. In children, the most common cause is brain inflammation. In adults, it is migraine. In the medical literature, no more than 180 individual patients have been described, 50% of whom recovered. However, larger-scale population studies indicate that fleeting, transient symptoms of AIWS are experienced by up to 30% of all healthy individuals. Accordingly, AIWS is generally considered fairly harmless in nature. We present here the first case description of an elderly male who suffered from AIWS due to Creutzfeldt-Jakob disease, CJD, an extremely rare neurodegenerative disorder. Our patient rapidly developed a state of dementia and died within 2 months after his visual symptoms had begun. Oh, do you feel like you might have one of these disorders? Don't worry. This is another syndrome that many medical students suffer from. They assume that they actually might have the issue themselves after they study it. Anyways, our time is up. I hope you find this video interesting. Tell me which one of these disorders seem creepier to you than the others. Write them in the comments. Please give a thumbs up to this video and share it with your friends. Also, don't forget to subscribe to the About It All YouTube channel and ring our notifications bell. Thank you for watching. About it all.